Hey everyone, my name is Arthur Burton, and I'll be talking about the moral right to healthcare in this presentation. Um, Everyone, in my opinion, has a right to healthcare. Whether it's a right or a privilege, that's subject to discussion, that's subject to argument between people, but in my opinion, it really doesn't matter. A moral right to healthcare gives people access to healthcare services when they need it. And how it can affect us, is it a benefit or is it an economical downside? Well, there's there's both about that. It is a benefit, yes, to have free healthcare, but there is an economical downside because the taxes would be a lot higher. When you think about places like Canada versus the US, in the US we pay about 20% tax, in Canada they pay about 40% tax, and that's because they have free healthcare. But what it does is it gives everyone the opportunity to be able to be treated, seen, and have access to medical healthcare. Now, the moral right to healthcare also speaks about three key elements that I believe are very important for the hospital industry. One of them would be the code of ethics. And a code of ethics is issued by a business and it's a particular kind of policy statement. And it's a code mainly about being ethical in business dealings. The Stark Law is a limitation that protects Medicare and Medicare patients from having unnecessarily taken. There are also limits of the power of physician referrals so that the patients are not referred to physicians, family members, friends, or individual institutions that they may have a financial relationship with. Um, Cultural competency. This is going to be very important, and we're going to get into this a little bit later in this presentation. But it's about communicating with people from different cultures and socio-economical backgrounds. Now, we do understand that yes, there is a difference, and basically, specifically, this is for human resources, not-for-profit agencies, and government. But cultural competency can be used as a very resourceful tool in the healthcare industry. So let's talk a little bit more about the code of ethics and the professional conduct. The code of ethics are elements that are important for the code of ethics. Staff needs to be trained, and this is stuff that we understand on what it is to be professional. But if we think about being ethical when we meet somebody and we say, well, how are you today, sir? Mr. Smith, how can I help you? We can understand how the code of ethics is going to be a very great tool for us in the medical industry. Also, the Patient Privacy and Confidentiality Act. We understand that patient privacy and confidentiality has been issues in healthcare because of security violations. In one article I read, they talked about there was a 138% increase of patient private privacy being breached, and I believe this is all a matter of training. I mean, if we train our staff to understand that the Patient's Privacy and Confidentiality Act is very important, not only because you can be sued or you can be prosecuted or sent to jail, but because it's ethical that people should not have access to anybody's medical records. And also, there's respect for human dignity. That should be a given, but people still need to be trained on that. Um, People don't want to come to the hospital and feel that they're being talked down to. They don't want to come to the hospital and feel like they're being treated less than a human being because they're being carted or moved or I don't have time, speak to this person. That the hospital staff needs to be trained to have respect for human dignity and how to speak to people and how to interact with people so that it's a positive interaction. And if we use the code of ethics training and we use this in our hospital institutions, we will look better to the community. The community will be more subject to see us, and that will make more people that need health care or are having medical issues want to come to our hospital. And then there's another thing about patients' rights. Do patients have rights? Of course they do. Do you have a right to see a doctor? Yes. Do you have a right to see a doctor even though you owe money? Of course you do. In the Declaration of Independence, it speaks about the right to life. So there's nothing more important to me than the right of life. So if a person comes in, or we shouldn't see the money or the dollar signs, but we should see, hey, here is a person. Here is a human being that is coming to us and needs help, and we need to explain to that patient their patient rights so they don't feel like when they left that they owe a bill and that they can't come back. Patients have rights to see a doctor irregardless on what they owe, who they owe, and they have a right to be treated with respect. Now, the Stark Law. This is a very interesting law to me because this law states that whether you can't use the excuse that you didn't know. Like, I didn't know that it was unethical to refer a patient to my brother or to a final institution that is, I work for them, and if I send them 5 patients, they send me $100. That's medical fraud and that's medical abuse. And the Stark Law, it protects the patient, but it also protects the government because the government is responsible for making these payments, and excessive billing, unnecessary tests being done is what has caused the Stark Law to be into effect. So what we need to do is that we need to speak with our doctors, our physicians, and our nurses, and we need to train them on the Stark Law. We need to do this annually. We need to upgrade it if there's any updates to the policies. We need to not only post them, but we need to bring everybody back in for another training session. The Stark Law, because of its severity, it can cause a hospital to go out of business. I mean, if we're referring patients to another hospital because our doctors are doing it and we don't know about it and we get sued, we can't go back and say, oh, we didn't know. That's just not going to fly. We're going to lose money. The government's going to lose money. So what we should really be doing is training and ensuring that all of our staff understands what the Stark Law is all about. Now, here's another one, cultural competency. I know we spoke about it a little bit before in the presentation, but I would like to give some of the benefits of it. This cultural competency it will reduce health disparities. It'll stop language barriers because you think about if you went to a hospital and you speak English and another person speaks Spanish and you can't communicate, you always have the opportunity to get an interpreter. Have an interpreter come so that so what you're saying to the patient is understood in their own native language. And if you have any doubt that the patient isn't understanding or following what you're saying, you should call for an interpreter. Speak to the administrator. But we need to train our people to know how to realize this, and also realize that there are cultural differences. That what I believe in my culture, they may not believe in theirs. I believe in shaking someone's hand when I first meet them, but I do understand in some cultures they don't shake hands. They find that to be offensive. So these are things that we need to be aware of. So, and once again, there's training that's needed, training for managers, training for the hospital staff in cultural competency, because we all are working in a community that may be a Latino community. And maybe the majority of the hospital are Caucasian. Maybe they're African American. So cultural competency comes into play it can come into play at any time during the day when you're in the hospital or when you're at work. Now, before I close, is to say that the moral right to health care, it will probably be something that people argue about through this presidential administration and maybe for another 10 president-elects. But the idea for us in healthcare is to realize, irregardless of what they're saying about the moral right to healthcare, everybody has that right. We're in the medical profession because we care about people. We want to ensure that people are taken care of. We want to ensure they get the best medical treatment possible. And for us to neglect this and neglect teaching our staff on how important healthcare is to this community, to the United States, to the world, then we haven't done our job as administrators. I want to thank you for taking the time to listen to my presentation. And once again, have a good day.